Hi everyone, welcome. As we dive into anatomy and physiology, one of the first things we learn is anatomical planes and position. And why do we need it? Well, imagine a doctor trying to describe the exact location of a tumor or a fracture without clear, universally understood terms. It could lead to serious errors and patient harm. And that's where anatomical terminology comes in, and a crucial part of this is understanding the planes. These planes are essentially imaginary two-dimensional surfaces that pass through the body. They're like invisible lines we use to get standardized view of the body and its internal structures. This helps us accurately describe locations and relationships, whether we're dissecting a cadaver or interpreting a medical image. Today, we're going to look at the three most commonly used planes: the sagittal, frontal, and transverse planes. First up is the sagittal plane. Think of it as a vertical slice that divides the body or an organ into right and left sides. Within this, we have two key distinctions. If this vertical plane runs directly down the middle of the body, creating equal right and left portions, it's specifically called a mid-sagittal or median plane. However, if it divides the body into unequal right and left sides, it's referred to as a parasagittal plane. To give you a very relatable real-life example, imagine you're making a banana split. To halve a banana into its two long, thin right and left sides, you'd cut it along what's essentially a sagittal plane. In medical imaging, sagittal views allow clinicians to see side profiles of structures, giving us a clear view from the side, which is super useful for looking at things like the spinal cord or brain from a lateral perspective. Next, we have the frontal plane, which is also very commonly called the coronal plane. The name coronal actually comes from the Latin word corona, meaning crown. This plane is another vertical cut, but instead of dividing into right and left, it separates the body or an organ into an anterior or the front portion and a posterior or the rear portion. Finally, let's talk about the transverse plane. This one is a horizontal slice that divides the body or an organ into upper and lower portions. Images produced from a transverse plane are often referred to as cross-sections. Think about slicing a cucumber or a sausage into rounds. Each round is the perfect cross-section, illustrating a transverse cut. In medical imaging, particularly with computed tomography or CT scans, you'll frequently see images presented as a series of transverse slices of the body. This allows doctors to examine structures layers by layer, from top to bottom, and this will reveal very minute details about structures in the body. So, to quickly recap, we've got the sagittal plane for right and left views, the frontal or coronal plane for front and back views, and the transverse plane for upper and lower cross-sectional views. Understanding these fundamental anatomical planes is absolutely essential because they provide a standardized and unambiguous way to describe the body's structures and location. This precision is critical for clear communication in our studies and, more importantly, in future healthcare professions.